Hello, thank you, and welcome to today's Word Round. My name is Dr. Chudi Ufondo of Snowspirations Global Health Solutions. Thank you so much and welcome. I hope you're having a wonderful weekend. I hope you're making out time to look after yourself and also get some rest. You see, weekends are very, very important to our health. So if you're a hard worker, when you've done your best from Monday to Friday, always make out time for Saturdays and Sundays. So weekends are very important, very, very important. You see, health is the totality of what you do every day. Health is not just the absence of disease. Health is your friends, your kids, your family, your mother, your father, your church people. Everything you do constitutes your health. So it's important you make out time for your health. Very, very important. Especially if you have families. Please make out time for the families. Check on the kids, check on your spouses. Sometimes we get so lost looking for money, doing our job, especially if you're working for people. You might end up doing your best for people you're working for, but you don't do your best for your family. It's important you spend time and know what the kids are doing. It's important you spend time with your spouses. Ask questions. Are you doing okay? Is there anything we can do? And also make out time for the family. Go to the park, take them out, just great time. Life ends and you only have one life. So always make out time for your health. Health is important. Now, when we talk about health, it's not just physical health, your mental health. Mental health is as important as your physical health. So take good care of your mental health. Mental health is very important. Mental health is an aspect of health that we don't practice better. But thank you for coming this afternoon. I appreciate you. Please, when you come in, let me know who you are. So tell me your name and your location. Very important. Your location is actually very important because we have a couple of places, we have services, so we want to make sure you have the best. Now, my name is Dr. Chudi Ufondo. Hopefully, in the next 1 hour, you're going to have an interactive section with me. So every Saturday about this time, we normally have our word round. So word round simply means I show up, I listen to your questions, I provide you feedbacks. Now, please remember, I can give you the best advice. I can give you the best recommendations. I can tell you the best options to become a mother, to become a father. At the end of the day, I can't do it for you. You are the only person that will do it for yourself. So I'm encouraging you, no matter what the problem is, live to tell the story. Own your situation. Accept your reality. Do something about it. It's June. Today is June 12th. 2021 is about to end. Refuse to go down the same. Refuse to blame people. We all have challenges. The fact you have your challenge today doesn't mean you're the only person that have challenges. I have my challenges. You have your challenges. But sometimes you let go of your challenges and you look forward to other people's challenges and you help them solve their problems. That's what we do in Snowspirations, and we are always here for you. This afternoon, I'm going to be assisted by Dr. Ndiche, Dr. Nkem, Ndiche, Dr. Delim from Nigeria. She's already in the clinic. I want you to focus on Chi Evelyn. She's going to moderate. So if you need to consult with us, please follow simple instructions. Very, very simple. Please don't come to my inbox and begin to expect magic. My inbox is not the place you can get help. Please go through due process. When you need help, go through the right place and you will get help. If there is any place to get help in the whole internet, in the whole social media, is this group. We are here for you. We will help you. So if you want to consult with us, come in at 1 week, come in at 1 month, come in at 3 months, come in at 6 months. If you are already pregnant, please attend the ANC in Telegram. Every weekend, we also have Word Round in Telegram. So we have two groups in Telegram. We have our ANC antenatal care for all women that are already pregnant. Then we have our Believing for Baby group in Telegram. So please, wherever you find yourself, bloom. We are gonna overcome. You will become a mother. You will become a father. Nothing can stop you. My daily prayer is that God will meet all our members at the point of their needs. My daily prayer is that God will multiply the blessings. The troubles you have will be doubled by the blessings God will give you. So if you're asking God for one baby, God is going to give you twins. If you're asking God for twins, God is going to give you quadruplets. God has done it before. So I'm not bullied by infertility. I have implicit confidence that God will bless all people in this group. Because when God made you a woman, God made you a woman for a moment like this. Now you are in the world, so you're going to have challenges. But the fact you have challenges doesn't mean it's the end of the world. When challenges show up, that's an opportunity to allow God to step in to show who he is. God has been there for us from day one. The Dr. Chudi you see every day is a product of grace. It's not because I'm the best, but God has made it possible to have this platform to reach every singular woman who has been crying in the past, who has been bullied, who has been called so many names, who the society have rejected, even the people that should love you. You have a place in this group. You can get help. You can be a mother. You can cry no more. You can be a father. Every single thing you miss in your community, you're going to get in this group. So that's the way of my introduction. Thank you so much for coming. Now remember, we have a big event on the 27th. I understand that greater number of our members have fibroid. Now the question is, why do you have fibroid? What is fibroid? Why do we have at least out of every 10 African women, you will have about 6 out of 10. 6 out of 10 diagnosed with fibroid. Why do we have that? If you have fibroid, how can we manage the fibroid you have and at the end of the day succeed in helping you to become pregnant, then not just becoming pregnant, have a good outcome? So if you have fibroid as we talk, if you are afraid of fibroid, if you are wondering if fibroid is going to affect your fertility, if fibroid is going to affect your pregnancy, if fibroid is going to affect your labor, please come, let's fellowship. On the 27th, we are going to dissect fibroid entirely. And we have a subject matter specialist, an amazing lady in UK, doing an amazing job. Excellent. You don't want to miss this opportunity. We also understand that so many of our members are abusing Clomid. Clomid is your friend and your enemy. So if you need to know more about Clomid, if you need to know how Clomid can help and harm you, if you need to know the connection between Clomid and cancer, you don't want to be looking for a baby and you end up having cancer. It doesn't make sense. You don't want to be looking for fun and you end up having cancer. There are so many things you don't know. So if you are in the habit of gulping Clomid, please come, let's fellowship. You will learn better. Put your resources where your treasures are. I know the economy is hard. Believe me, I know it's for everybody out there. But I challenge you to do something in 2021. I challenge you to do something in June so that the remaining 5 months in 2021 will end strong. It doesn't matter how you start. What matters is how you finish. So I want you to finish strong. So come, let's fellowship. Follow the admin. Come for that event. You will learn. If you know anybody who needs help, in the past, we have had women that died from fibroid surgery. No woman should die from fibroid surgery. But you need to know the right things to do. You need to know your chances. You need to understand that despite the fact you have this fibroid, you can still be a mother. You can still have a relatively pain-free pregnancy. So come, let's fellowship. Now, we also have a couple of PDFs. So if you didn't attend our multiple pregnancy event, this is an opportunity. grab a copy of that PDF. It's discounted. Please attend. Okay, now that's aware of the announcement. So the clinic is going to open now, and I'm ready to start taking care of your questions. Dr. Ndiche is going to be in the background, and she's also going to be providing feedbacks. So focus on Dr. Ndiche, focus on Chi Evelyn. If you need anything from us, we are going to be there for you. But right now, the clinic is open. Please go ahead and ask your questions. The clinic is open. So this particular broadcast is on our page, is in our group, is in YouTube, is in Instagram, and also my timeline. So if you're in YouTube, check us out in YouTube. Admin, please post all the links of our correspondence. Check us out in YouTube, check us out in Instagram, check us out in Facebook, and in my personal timeline. So no matter where you are, you can get help. But right now, I'm going to help you provide feedbacks to all your questions. So let me see what we have. Okay. Let's go. And also, Dr. Ndiche will be in the background providing backups. Thank you so much for coming, Dr. Ndiche. Very busy doctor, but always puts our group first. Okay. How possible can someone that's diagnosed with diminished ovarian reserve at 38 still get pregnant naturally while fertility treatment given by a reproductive endocrinologist? So it's important you understand that the fact you have a diagnosis doesn't mean you cannot get pregnant. So the fact you have diminished ovarian reserve, it means it's diminished. It doesn't mean it's completely depleted. Diminished and depletion is not the same thing. So it's reduced, and it actually starts reducing on its own by 35. So it doesn't mean you can't get pregnant if you have diminished ovarian reserve. It means that if you had 400 previously when you were in your 20s, right now in your 38, it's possible you might have 40. So the question is, what are you going to do with the 40? So the advice, do measure. The advice is to do measure. The advice is to understand that the fact you have diminished ovarian reserve doesn't mean you still can't become pregnant naturally. You can become pregnant naturally. So keep on doing what? Praying, playing, and practicing. Pray every day. Play every 48 hours. Playing means make love 48 hourly. Then practice. So it seems you're doing the three things. Okay? So continue making love with your partner. Continue meeting the endocrinologist. Continue meeting with the fertility specialist. I will personally ask you to go for IVF. Why should I give you IVF as an option? Because you have depleted ovarian reserve. So assuming you had 400, now you have 40. And at the end of this 2021, if you had 40, you're going to have about, you're going to minus 12, because every month you bleed, every month you're supposed to ovulate. So if you're going to ovulate every month in 2021, you would have ovulated 12 eggs. And you're 38. So you do not want to miss that opportunity of having a baby. So personally, what I will advise you to do is to continue making love with your partner, trying naturally. But if you genuinely want the best advice, go for IVF. So if you're going for the IVF, we're going to check your eggs. We're going to check the quality of the eggs. If they are still good, we're going to use your eggs to get you pregnant. Now, the beautiful thing about going for IVF is the fact that if God wills, you can have twins, you can have quadruplets, you can have triplets. So despite the fact you have diminished ovarian reserve, you can still have multiple pregnancy. But you might not be able to do that by yourself, because naturally, as you're getting older, when you get to 35, your fertility drops. So the best advice I will give you, my sister, is to find a very reliable fertility specialist with the endocrinologist. Then please go for IVF. Now, in the event you are planning for IVF and we check your eggs and your eggs are not good enough, please go for donor eggs. The same thing is applicable to the men. I understand it's very difficult to tell a man that the sperm is not viable. I understand that. I understand the worst thing that can happen to a Nigerian man is to tell him that he doesn't have sperm. But unfortunately, some men do not have sperm. They have what we call azoospermia. So the question is, what do you do when you don't have sperm and you still want to be a father? You see, life is about what you have. When you have something, you can use it. But when you don't have something, what do? You get something. So if you're a man and you have azoospermia or you have oligospermia, what you need is to see a urologist so that we can start early to diagnose and figure out how we can help you. If at the end of the day, you frankly have azoospermia, that means you no longer have sperm, but you want to be a father, what is the right thing to do? Donor sperm. The only three people that should be aware of what you need to do to become a mother, to become a father, what are the only three people that should know? Yourself as the woman, your partner as the husband, or whatever nomenclature it's, then the fertility specialist. These are the three people that should be in the know of what you did to become a mother or a father. So long as it's legal. I'm not telling you to go for phantom babies. I'm not telling you to go for crippling pregnancy. I'm telling you to go through the normal routes. There are so many ways you can be a mother. There are so many ways you can be a father. You can be a mother naturally through the vagina. You can go for fertility treatment. You can go for IUI. You can go for IVF. You can go for surrogacy. You can adopt. You can foster. They are all pathways of becoming parents. Unfortunately, so many people don't understand this. Then when it's late, we begin to go helter-skelter. Fertility doesn't develop overnight. Infertility doesn't develop overnight. Infertility is a build-up. Infertility takes time to develop. So if we are going to take care of it, it also needs to take time to be managed. Anybody telling you you're going to take this magic pill and you begin to have all the babies in the world is only interested in your money. So this is why we are methodical. So if you have infertility problems, if you are assigned under me, what do? I will ask you about 23 questions. I will ask you for some results. I need to know your hormone profile. I need to know your ultrasound. I need to know your HSG. I need to know the seminal fluid analysis of your partner. Then I can begin to advise you based on what the outcome is, based on your chances. But every desiring parent can become a mother, can become a father. But how you become is not going to be the same. Everybody is wired differently. How Madam Okeke can be a mother might not be necessarily how Madam Okonkwo can be. Both of them can even be twin sisters, and this person can have this, and that person can have that. That's why we are different. We are not the same. But please do something. The general motto of this group is what? Pray, play, practice. And that's why you see me every opportunity I have. I keep preaching PPP. PPP works. It doesn't matter your age. It works. When you pray, God answers. When you play, you can score a goal. When you practice, you can become. This is my confession. From day one, it has not changed. This is the basis of this group. You have to do your own part. There is no way you can escape this. Okay, so let's continue, guys. Okay, keep asking your question. Is it true that when we are not supposed to make love 5 days after ovulation if we are trying to conceive? Completely nonsense. Completely false. In this group, we are the love-making group. We make love every 48 hours. Why is it relevant to make love every 48 hours? Especially if you're 35 years and above. I'm going to explain it in the simplest terminology. Now, every woman has a cycle. So the cycle is the interval between your bleeding days. So let's use the example of May. When did you bleed in May? If you can mark the first day you bled in May, that's the first day you need to take notice of. Then if you've already bled in June, the interval between May and June, it's your cycle. Now, the normal cycle is 21 to 35 days. So if you bleed every 21 days, it's normal. If you bleed every 35 days, it's normal. So within that bleeding days, you are expected to ovulate if you're still within your reproductive phase. So what do I mean by still within your reproductive phase? If you still have eggs in your ovaries, it's expected that in the middle of your cycle, you release your egg. That process of releasing the egg is what ovulation is all about. Now, when you release your eggs, and we have an available sperm in the vagina, that sperm can get you pregnant. Thankfully, the sperm can get a woman pregnant 5 days before the ovulation, but the egg can only survive within 12 to 24 hours. So why do we preach 48-hour intercourse? Because as you're getting older, the possibility you have irregular period, the possibility you might not even be bleeding every month is high. And when that begins to happen, you can no longer calculate effectively your ovulation. You can no longer calculate effectively your fertility window. So what do? We make sure that at any time you come to the vagina, we have fresh sperm. So a woman that has 28-day cycle is expected that on day 14 you ovulate. But when you get to 35, and with so many things happening to you, environment, genetics, your mood, your sports, lack of sleep, stress, your cycle can flip from 21 to 25 to 27 to 35. So if you are waiting for that particular time, you think you are ovulating to make love. Once you miss it in a month, you have to wait for another month. So once you miss your chance of becoming pregnant in June, you have to wait for July. But we don't want to take chances. So we encourage you to make love consistently. Why? So that at any point in time, the egg decides to come, you have a sperm to get that egg fertilized. This is the simple reason why you need to make love 48 hourly. We do not practice admin, capture this. We don't practice ovulation sex. We don't practice fertility window sex. We just don't practice because we don't know. If everybody knows, then we won't have infertility. The fact you're looking for a baby means something is wrong. So what do? We use all our available options. So if you are getting older, the possibility you will have irregular period is very high. And once it begins to be irregular, we can no longer predict your ovulation. We can no longer predict your fertility window. So what do? We increase our chances. We increase our probability by making love around the corner so that at any point in time, when you get to the vagina, you have fresh sperm. When you have fresh sperm, if the eggs do measure, when you have fresh sperm, anytime the egg decides to come, the sperm will fertilize it because the sperm can still be viable 5 days. So if your partner made love to you on Monday, your partner can still get you pregnant by Thursday. This is how it works. This is why you need to be careful. You see, when you're looking for a baby, there are so many people that will tell you so many things. And if you're not careful, you will begin to practice them religiously. And if you're not careful, those things they are telling you to do will be the things that will stop you from becoming pregnant. Let me give you an example. If you are currently taking Clomid, which a fertility specialist did not recommend, you are going against your fertility. You are not increasing your chance of becoming pregnant because you don't even have Clomid problems. This is why every woman should need a gynecologist. This is why every woman having infertility problem needs a fertility specialist, because it's not a quick fix, my sister. You know, some of you will subscribe. There's a lady that subscribed yesterday. You know, she came in this morning and she was harassing me. Oh, this, oh, that, my husband will not do this. My husband. Look, when I'm showing up, I don't care what your husband thinks. What I care is what you need to do to become pregnant. Because some of your husband, you don't even understand the body of a woman. And it's not about what you think or care. But that's the truth. Some of you are not able to become pregnant today because what your husband wants or doesn't want. It doesn't matter what he wants or what he doesn't want. What matters is what you need to do to succeed. But unfortunately, some men are just sitting in one place. I want this. I don't want that. Don't go for this. Go here. Go there. And some of you don't even have sperm. And without sperm, you can't become a father. So it doesn't matter what you want or doesn't want. What's important is what you need to do. And if you need result, you're in the right place. But the only person, I keep saying this, the only two people that can stop you from becoming a mother and a father in 2022, both of you as the woman and you as the man, you are the only two candidates who can decide not to become a mother, not to become a father in 2022. You can go and quote me. Because you can become a mother in 2022. You can become a father if you put it on your top list. And I know it's expensive. I know. Fertility is difficult. But guess what? Difficult things are done by tough people. God gave us the ability to do anything that will make us fathers and mothers. Because your biggest achievement in life is the fact that you're a mother or a father. If you want. There are some people that don't want to have kids. They just want to enjoy themselves. But if you desire to be a father, if you desire to be a mother, how are you going about it? What are you doing differently? Are you showing up telling me what you want? You're not God. God knows why he's delaying things, because there is a difference between delay and denial. God cannot deny anybody he gave a breast. God cannot deny any woman he gave a womb. So why did God give you a womb in the first place? God doesn't make mistakes. God is always on time. But God knew you're going to be in Nigeria. God knew you're going to be looking for a baby now. But you need to look for this baby the right way. So I'm talking to the men. Come down from your high places. Come down from your pride. We are talking about your family. This is your family. This is your kids. It's not mine. I have mine. So stop delaying the time. Especially for women above 35. You don't have the liberty of telling me you're coming and going, because guess what? It's possible you have only 12 eggs in 2022. So what will happen if I told you to do this in January and you're telling me you're coming? By June, you only have 6 eggs remaining. So what are you going to do by December when you no longer have eggs? Are you going to do magic? No. Because when you don't have, you don't have. So let's continue. Is fertility specialist different from a gynecologist? Yes, my sister. You see, for you to be a doctor, you have to go to your O levels, advanced levels, medical school, housemanship, residency, and all those stuff. When you become a gynecologist, you are especially interested in the issues that border on female health, everything related to female issues. You are a gynecologist and an obstetrician. Now, there are some gynecologists and obstetricians who specialize only in anything that regards to infertility. The only area which they know how to do better is only in helping people that have problems. So they are called fertility specialists or reproductive endocrinologists. So if you are 35 and above and you have been wanting to become a mother, we don't try, we believe. You've been believing to become a mother and you're practicing your praying and you're playing 48 hours and you're practicing. That means you have a fertility specialist. At the end of the 6th month, you are now going to be classified as having what? Infertility. At that point, what do you need a fertility specialist? If you are younger than 35, when you have tried praying, playing, and practicing for 12 months, and at the 13th month, if you're not able to become pregnant, what do? You escalate and you seek help under a fertility specialist. So a fertility specialist is a specialized doctor who only deals on anything infertility. And that's who you need. Okay? Very good question. I always love making things simple. So guys, ask your questions. Let's see what we have. Let's see what we have. Keep asking your questions, please. Okay, let's see. And remember, Dr. Ndiche, is it possible to ovulate with just having low abdominal pain and breast tenderness as signs? Yes. Ovulation can have non-specific symptoms. Breast tenderness, mid-cycle pain, spotting, increase in your cervical mucus, increase in your basal body temperature. They might all be non-specific signs you are ovulating. So yes, you can ovulate. But guess what? We don't want you concentrating on your cervical egg white mucus, calculating ovulation, knowing this, knowing that. We don't care. What do we do? Whether you have all those signs or not, just make love. Because some women might not have increase in cervical egg white mucus, no breast tenderness, but they have released the eggs, including women that recently had a baby. So in as much as I want you to know your cycle, in as much as I want you to know your ovulation and your fertility window, but I don't encourage you to just wait for that particular time in the month to start making love. No, because you can miss it. Okay? How often should a woman exercise? Regularly. Every single day. You can have 2 days as rest. So you can take Saturdays and Sunday off. But a woman, especially if you want to be a mother, you need to go on regular exercise, at least 30 minutes exercise daily. Exercise doesn't mean you have to go to the gym and be killing yourself. No, you can dance, you can walk, you can bicycle, you can do push-ups. Anything that gets your body going for 30 minutes. You can break it 10 minutes apart. You can go for a walk. Fortunately, you can be exercising and you can still be gossiping. You can still be doing your social media. You can still be in Facebook. Just make sure that the place you're exercising is safe. I had my exercise. I was in my treadmill this morning and I was still consulting. So learn how to multitask. Why do you need exercise as a woman wanting to become a mother? Because your hormones are subject to your body weight. So if you're overweight or you have obesity or you're underweight, it's going to affect your hormones. So if your hormones are not in the right place, you're not going to become pregnant. So if your estrogen, progesterone, FSH, LH, thyroid hormones, if they are higher or lower, it will affect your ability to ovulate. And if you can ovulate, you can become pregnant. So you need to make sure that as a woman, your body mass index, admin, please, can you post the formula for body mass index? Every member of our group should know how to plug in their body weight and height and calculate the BMI. Please, if you calculate your BMI and your BMI is below 18.5, we want you to bring it up. So we don't want it to be underweight. And also, if your BMI is above 20.5, we want you to keep it within 18.5 to below 20.5, because if you are higher, it begins to give you a problem. So you need to be fit. Okay? Keep asking your questions. Dr. Ndiche will be providing feedbacks. So the ones I don't capture, and admin, you can always repost so I can provide feedbacks. Guys, I plan to spend 1 hour. So we have about approximately 28 minutes. So this is your opportunity. Can a 7-month-old pregnant woman engage in exercise? Yes. Even in pregnancy, you can go for walk. So there are some very simple, safe exercises you can indulge in pregnancy. Every living individual needs to exercise. Every singular person. But remember, we have mild, moderate, and severe exercises. So make sure that if you're pregnant, you don't go jumping up and down and carrying all those body weight if you're pregnant. You can go for a walk. Walking is a form of exercise. Okay? Guys, keep asking your questions. Keep asking your questions. Remember, if you're in Abuja, if you're in Asaba, Oka, Benue, Calabar, Enugu, Jos, Kogi, Kano, Lagos, Nnewi, Osun, Owerri, and Poraka, we can refer you. The criteria for referral is to subscribe. So if you need to be referred, you can come in for 1 week, 1 month, 3 months, 6 months, BFB, ASC. Okay? That's what you need to do. If you need to be referred to a specialist. Okay? Unfortunately, right now, it's only people in Nigeria that can be referred. And I told you guys a recent good news we had. One of our members that came from Italy went to Enugu. She's pregnant after 13 years. So impossible is nothing in this group. Its fertility specialists have already provided feedbacks. They are different people. When can one take blood pregnancy test? As soon as you're confirmed pregnant with your urine test, book an appointment to the hospital. Go to the hospital to check your pregnancy test with the blood. Why? Blood test is a quantitative and a qualitative test. Your urine test is going to tell you you're pregnant. Your urine test is not going to show us the level of the beta HCG. But when you're going for your blood test will tell us you are pregnant. And yes, your beta HCG is doubling as expected. Now, the final test you need as a pregnant woman is what? Ultrasound. So every pregnant woman must go for confirmation of their pregnancy through ultrasound. Why is this important? Because unfortunately, some women can be pregnant, but unfortunately, they can have non-viable pregnancy. So they can have molar pregnancy, they can have ectopic pregnancy, they can have blighted ovum, they can have missed abortion. These are all chemical pregnancy. So these are all non-viable pregnancy. It means you were pregnant, but unfortunately that pregnancy could no longer proceed. So we need to have an ultrasound that will tell us that this baby is actually inside the womb. So every pregnancy must go through urine, blood, and ultrasound. Until you've gone for your ultrasound, you are not clinically confirmed pregnant. Very important. Okay, guys, keep asking your questions. Keep asking your questions. If your questions are not answered, you can ask again, and I'll provide the feedbacks. Okay? And remember, when you subscribe, make conscious effort to follow due process. Please, if you don't have email, don't bother. That's the truth. We need to be responsible. We need to be disciplined. And please, if you and your partner are not on the same page, please don't even bother. I've had so many people that gave me so much headache. I see a lot of people. So I need the two parties to be on the same page. You cannot become pregnant as a single woman. No. You need your partner to be there with you. So if both of you are not on the same page, don't waste your money. Make sure you fix your family. If you want to be a mother, you need your partner. If you want to be a father, you need your partner. We only want serious people. It's a labor of love. So please fix your family before you begin to look for a baby. 7 months pregnant, anytime she eats, the baby always comes to the navel, immediate. It doesn't matter. Your baby has the right to move all over the place. So don't worry about that. So long as that baby is okay, that's all we care about. How does basal body temperature help in determining if someone is ovulating? When you are ovulating, your temperature goes up. So when you check your basal body temperature with your thermometer, if you get a spike about the time you are supposed to ovulate, that's an indication you've ovulated. That's how we use the basal body temperature, okay? Kegel exercise is pelvic floor exercise muscle. When you engage in Kegel exercise, it actually helps to strengthen the pelvic floor muscles. It can improve your lovemaking, it can improve your urination, it can improve your defecation. Your pelvic floor muscles simply make sure that you have strong pelvic floor, strong muscles that will help you to have your baby, to urinate, to do all those things perfectly. Now, Kegel exercise, admin, you can post the link to the article and they can go ahead and do that. Picture yourself wanting to pee, then holding your pee midway. Let me repeat. Or let me give another example. Picture yourself. You probably ate beans yesterday. Now you're in a class or you're in the office and you don't want to release that deadly poisonous gas. And you are holding your fat. You are holding it midway so that you will have ample time to get to the restroom. The same muscle you use in stopping your urine midway, in stopping yourself from farting, those are the pelvic floor muscles. If you can identify those muscles and put tension on it, contract it for a few minutes, release it, contract it again, then you have identified your pelvic floor muscles. You can do this consciously to improve the strength of your pelvic floor muscles. Just to make it easy. Okay, admin already provided the links, and I think we have a PDF on that. So follow that PDF. Every singular woman should know how to practice Kegel exercise. Kegel exercise will strengthen your pelvic floor muscles. It's natural, it's effective. It's a way of having a very positive impact on your general health as a woman. It can also improve your sexual practices. Okay, guys, keep asking your questions. Please, if you don't understand, the word round is an opportunity to understand. So instead of listening to what your friends will tell you and you begin to do the wrong things, please ask all your questions today. What does it mean when estradiol is low and FSH is high? It means that you're likely getting older. So for every woman, when you reach 35 years, your estrogen level will keep dropping naturally, and your FSH will keep going up. When that begins to happen, your fertility is dwindling. Your fertility is being reduced. So you need to act on time. Every woman will get to menopause. So when you're getting older, the level of your estrogen, which is the hormone that makes your vagina to be moist, to be, to have intention of sleeping with your partner, will begin to drop. When it begins to drop, you begin to feel dry vagina. You begin to feel hot flushes. You begin to feel that you don't even have intention of meeting with your partner. That's a natural thing. When this begins to happen, when estrogen is coming down, FSH is going up. So both of them are like, cat and dog. They don't like each other. When your FSH is going up, the likelihood that your fertility is decreasing is there. So you need to act on time. Nobody can stop aging. Unfortunately, a woman doesn't have eternal fertility. A woman's fertility ends by the time she gets to menopause. So you need to make conscious effort to make sure that before you get to menopause, you would have used the eggs that God gave you. But here is the good news. If unfortunately you no longer have eggs, you can still use donor eggs, even in your menopause, to become a mother. Thank God for modern technology. Okay? What causes seeing blood during sex? Couple of things. It's possible you're not well lubricated. So it can be friction, it can be infection, it can be inflammation, it can be fibroid, it can be other gynecological problems, including cancer. Okay, so if you experience this frequently, go to a gynecologist so we can know. But unfortunately, so many women don't know how to make love. Admin, please, can you share the PDF of love making? Share, matter of fact, share all the PDFs. Share all the important PDFs that people might be interested in. Please find the PDF that will help you to know your body better. We have PDF on multiple pregnancy. We have PDF on fertility food. We have PDF on Kegel exercise. We have PDF on so many things. I've forgotten a whole lot of them. I think we have about 15 or 20 PDFs. So admin, take time and share the comprehensive list of the PDF. If you want to get any of them, please come in the middle, send email. We're going to make it available to you. Okay, guys, keep asking your questions, please. Keep asking your questions. The lady asking about ovarian reserve, diminished ovarian reserve at 38. I've already provided you feedbacks. You're asking if you can become pregnant naturally and also under the care of a reproductive endocrinologist. And I said, yes, you can become pregnant even with reduced ovarian reserve. But your best chance when you have reduced ovarian reserve is to go through IVF under the technical assistance of an IVF specialist. That's the best chance, because diminished ovarian reserve means if care is not taken, by the time you come back in a few months, you would have used all your ovarian reserve. So you need to act on time. Okay? Vagina pain, skin skitting together, causing peeling, so you probably have an inflammation, my dear. You need to see a gynecologist as soon as possible. Do you have referral outside Nigeria? No, we don't. Only in Nigeria. Okay? Let's continue. Keep asking your questions. Okay. Thank you, Dr. Ndiche, for providing feedbacks. Thank you, Ichi Evelyn. Is it possible for AS couple to have children that are not SS without going through IVF? Yes, it's possible. But why do you want to take the chance? Okay, let me show you how this works. Let's illustrate this so you guys will see. Let me draw something. I'm going to show you guys something now. Give me 1 minute. Let me do some biology. Okay? Okay? Okay. I don't know if you guys can see this, but this is AS couples and the combination of kids they can have. So you have 25% chance of having a baby that will be AA if you're AS couples. So if you're AS and your partner is AS, both of you can have AA baby, 25% chance. Both of you can have AS baby, 25% chance. And both of you can also have SS babies. So the A you have can be contributed. The A your partner will have can also be contributed. Then you can have AA. The S you have can combine with the A your partner might have, and you can have AS. The S you have can combine with the S your partner have, and you can have SS. What we are trying to avoid is because we are not God. So we don't know how the babies are gonna come. But yes, you can have AA, you can have AS, and you can also have SS. Now, we don't know the sequence. Some people can have 4 babies, and those 4 babies can be AA, and no problem. Some people can have AS. Some people can also have SS. So why do we want to take that chance when you can avoid this? So personally, I don't like doing things I will regret in life. Avoid it. If you are already in that relationship, then you need to go and shop for a lot of money and go for PGD, pre-genetic testing. So there is a way we can check your embryo and make sure that the only one we are going to allow to proceed are the ones that are not sickle cell. And I know so many of you have religious background. I know you might not be able to condone that. So why do you want to go for something that will hurt you? Why do you want to bring in a baby into this world that will have pain until the baby dies? Why do you want to do that? Okay? What causes a lot of clot during period? Likely you have fibroid. Number 1 cause of clothing and heavy bleeding, and you need to go and check yourself, okay? All right. Okay, guys. Ask your questions. You have about 15 more minutes to go. Okay, keep asking your questions. I keep seeing the questions I've provided feedbacks on. I need every other person that need feedbacks to ask their questions right now. You're 6 weeks pregnant, but no morning sickness. It's not a must you have morning sickness. Women have pregnancy symptoms differently. So there is no good standard for all the symptoms you have in pregnancy. Some women will have just a tiny baby in their womb, but they will be vomiting for the whole community. And some women will be carrying twins and they will not be vomiting. So your morning sickness is not a must. Some people can have it, some people cannot have it. Okay? Just make sure you register for your ANC on time. You are 6 weeks. You have a long way to go. We encourage all pregnant women in our group to be in our ANC group in Telegram. When you are in our ANC group, every single day you have a window of opportunity to ask your questions. Then I and Dr. Ndiche will come and attend to your question. The same thing is applicable to people that want to become mothers in 2022. You have a window in BFB Telegram group to ask all your questions. And you also have an opportunity to be referred, okay? Guys, keep asking your questions. Keep asking your questions, please. And guys, you can't go wrong with water. This is your best friend. So while you're praying, playing, and practicing, embrace your water. You cannot go wrong with this. This is life. If you can stop your soda, stop it. You see the funny thing, when they tell you 0 calorie, reduce sugar, low fat, it's a lie. Soda is soda. You don't need them, including your Zobo. Embrace your water. This is life. This represents life. You can't go wrong with water. So drink a lot of water. When you have done your exercise, drink water. Avoid stress now. You don't look, life is already stressful. Avoid stress. Things that don't matter, don't go argue. Some people spend the whole of their time in Facebook fighting, arguing, war everywhere. There is no trophy, my sister. You don't have that liberty. You use your hard-earned money, which you should use to subscribe or to go for IVF. You use that little money you use in putting money in the data, right? It adds up. A drop of water can rain. You use it to be fighting all over the place. There is no trophy. So worry about the important things. Find a group that will help you to become a mother, to become a father. Stay in that group. Practice. Share knowledge with each other. Share this video with your partner. Share this video with your sister, your friend, people that are having difficulties. Show them that they have hope. You can become a mother like other people. There is nothing wrong with you. But act on time. Time is of essence. Okay, guys, I have 10 more minutes. 10 more minutes. Okay? Ask all your questions. If your questions are not answered, it's not intentional, but you can ask again and I can pick it up and I can provide you feedback. So please ask your questions. Okay, I'm going through to see if I can see any. Admin, you can also repost. Thank you, Dr. Ndiche, for, okay. You're not having your monthly cycle, then you later took some medication so that your cycle can flow. Is it advisable to keep taking medication? No. You go to a gynecologist, you go to a fertility specialist. You do not take any medication by yourself. You are simply not helping yourself. You are a matter of fact reducing your opportunity of becoming pregnant. Anytime you go about taking any drug without prescription from a doctor, you're not helping yourself. So stop today. Okay? All right. Okay, you went for embryo transfer today. You have abdominal pain. Hope no cause for alarm. Well, your body is very sensitive. They've been pumping your body with a lot of, hormone drugs, and now they introduce certain things into your body. Definitely, you have little nick of pain here and there. I'm not really worried about that. You can pop your paracetamol, and let me tell you the truth, my sister. Once you've done your embryo transfer, go and just relax. You've done your own part. That's the point that God will step in and begin to act God. God can multiply that embryo. That baby can go in there and say, you know what? I'm not just going to be alone. I need my brother. I need my sister. They can divide. God can divide your one fertilized embryo. The person can say, you know what? I need a twin sister. I need a twin brother. So you have done your part. A lady that was supposed to have a transfer today was freaking out yesterday, worrying, what if? And I said, what about what if he succeeds? When you're thinking about what if he fails, think about what if he succeeds. Think about what if you get pregnant and you have twins and you have triplets. There are so many people that will have quadruplets. In this group, the only thing stopping you is fear. The fear of unknown. When fear knocks, let faith arise. You can't be a mother if you're not courageous. You can't be a mother if you're not faithful. We face fear every day. Fear of unknown. What if he fails? You had negative result. He failed it last year. What about this year? What if he succeeds? You're not a failure. When something fails, there is a reason why it failed. But when God says you will become, against all odds you will become. So don't even worry about it. When you have done your embryo transfer, you have done your best. That's when God will step in and God can do amazingly, exceedingly. God can blow your mind away. God can tell the whole world to shut up and say, have peace. I'm God. Who made you? That's what God can do. And God is going to do it for somebody today. But you need to meet God halfway. You need to face your reality. Unfortunately, so many women are easily irritable because you don't have a baby. So anything people tell you, you react to it, on the negative side. You have to still retain that your good nature. You have to still be calm because guess what? If you are stressing, stress can affect your fertility. Lack of sleep can affect your fertility. Overeating can affect your fertility. Not eating can affect your fertility. Everything you do every day can affect your fertility. So you need to tell yourself the truth and relax. Relax and make love and make babies. Okay? Okay. All right, let's see what we have. Let's actually wrap up. I have 6 more minutes. 6 more minutes. 6 more minutes. Make sure you attend the upcoming Clomid Fibroid Summit. If you've been told you have fibroid, if you've been using Clomid, if you've been deceiving yourself, this is an opportunity for us to fellowship. Register today. Now, if you have been blessed, don't attend the party alone. Come along with other women. There are some women that cannot afford services, but there are also some women that God have blessed. If God has blessed you since you started following me and you want to thank the group, please decide. What is it? Come here. What is it?
I thought it was sent something to me.
Because you were distracting. That is on live video. What do you need?
Nothing.
Okay, then go down and be a good boy, okay? All right, guys, let's wrap up. Okay. I'm checking for questions. And if we don't have, Doc, we don't try in this group, my sister. So there is nothing like TTC. We have BFV. We believe God for babies. Now, the best thing you need to do if you want to be a mother is to start taking your prenatal multivitamins 3 months before the period you're anticipating to become pregnant, then 3 months into that pregnancy. If you're in Nigeria, the recommended multivitamin is Pregnacare. Pregnacare is good. Yes, blood tests can dictate pregnancy after 10 days. Look, the best time to check for your pregnancy test is 7 days beyond the time you're expected to bleed. So if you missed your period, give it 7 days. Your pregnancy test will first of all be positive in the blood before it becomes positive in the urine. So your blood test is superior to the urine test. Okay? Okay, guys, let's wrap up. 4 minutes. 4 minutes, and I'm done. It looks like the questions are provided feedbacks. It's just the ones that keep popping up. If you have questions, please, this is our opportunity to ask. Surrogacy. Okay, someone is asking about surrogacy, right? So in surrogacy, unfortunately, for some reasons, your womb is not able to carry your baby. Okay? Unfortunately, there are some women in that condition. There are some women that can carry their baby for some medical issues, for some womb deformities, for recurrent miscarriages, but they have eggs. Some other women might not have eggs, but they want to become mothers. Now, in surrogacy, there are 3 parties. You as the woman, your husband, and another woman who is called the surrogate mother. So in surrogacy, what happens? We are going to first of all identify that your womb cannot carry your baby. We are going to go for another woman who will be medically certified okay, who will be in tandem, who the agency will agree on, who will decide legally to be the person that will carry your baby. So what do? We are going to take the care of the 3 of you. So you, your partner, and the surrogate mother. We are going to give you a couple of medications to make sure that your eggs are going okay, to initiate the production of your eggs. We are going to collect out your eggs. We are going to collect your partner's sperm. Then instead of putting it in you for that IVF, we are going to put the combination of the egg we got from you, the sperm we got from your partner, which will form an embryo. We are going to transfer it to the woman that will carry your baby. That's called surrogacy. So in surrogacy, another woman who is preferably a younger person who is in good health will be the person that will carry your baby. So once that baby is delivered, that baby becomes your own, then legally the woman will go her way. Her contract has ended. That's what surrogacy is all about. Now, in some couples, we have some, unfortunately in life, our situation is more like people that cry they don't have shoes. When you don't have shoes, you can always wear shoes, right? But if you don't have eggs, you can't wear shoes. That's exactly how our condition. There are some people that have gone through hell looking for babies. There are some couples that they don't have sperm, they don't have eggs, but they still want to be fathers. So they can go for both donor egg, donor sperm, and still go for surrogacy. So in some situations, they can go for donor egg, donor sperm, and still look for another person to carry that combination. Whatever you need to do to become a parent, become. The opposite of not becoming a parent is to be single. And there is nobody that God made to be single. You are given the ultimatum of multiplying. I know so many of you come from very strong cultural background and religious background. I obey my husband, my pastor, my mom, my this. Guess what? What about you? What do you want? What will make you happy? If becoming a mother is going to make you happy, then I don't care what your pastor says. I don't care what your husband says. You just do things that will make you happy. Do you know why? The same society that will be telling you not to do this, not to do that, will be the same people that will criticize you. They will be the same people that will be in your graveside the day they will bury you. They will be the same people that said, oh, we told her to do this, she didn't do this. So no matter what you do in life, you cannot please the world. So always do things that will make you happy. If you know that having a baby is going to make you complete as a woman, go and have your baby. Go and have your baby, my sister. Don't worry about what the world will. The only thing people do is to talk. People are gonna talk. Whether you do the right things, they will talk. Whether you do the bad things, they will talk. Whether you do ugly things, they will talk. That's what people do. They talk. But this is your life. You only have one life. You can only live once. That's a fact. Whether you're going to come back for rapture, whether you're going to come back for the second coming, we don't know yet. It's between you and your God. But while you are here, decide to live happy. Choose to be happy. Despite your infertility, despite you don't have a husband, despite you don't have a wife, despite you don't have money, decide to be happy. It's a choice. That you are happy doesn't mean you don't have problems. Stop wearing your problems on your shoulders. Stop complaining as if your problem is the worst problem in the world. There are so many people that don't have legs, and we are crying we don't have shoes. No. Just do something different. Do something different. Okay, my sister? If you want to be look, the joy of motherhood, that one I can tell you, they have not described it in dictionary. The joy of fatherhood, maybe. Becoming a mother makes you complete. Let the thought of seeing your babies run all over the house wake you up to reality. You are 50 and you're still waiting. What are you waiting for? You are 60 and you're still waiting. What are you waiting for? You are getting to menopause. You're still waiting. Meanwhile, you know that you can't use donor eggs because of your faith. Some of you will be bad. My dog, it doesn't. One partner came in and he couldn't go for semen analysis because he refused to masturbate. Oh, my faith. Oh, my this. Oh, my that. If we need blood from you for test, do you give your blood? You give your blood. Now we need your sperm. And you remember you're a Christian. And you remember you don't do this. And you remember you don't do that. If you don't have a problem, who will tell you to masturbate? My people, let's do the right things because we don't have this opportunity to come back again. If you are admin, capture this for me. If you are 35, you are in the evening time of your life. Evening, not afternoon. You are advanced. You should not be in the back seat. You should be in the front seat. You should be the team that will say, let's go. Because your chances are dwindling every single day. So if in 2021, you have not had a family meeting, you have not budgeted money, some of us are stingy, even to ourselves. Some of us have stocked money for December. You have arranged all their shebis. You bought the best cars. You live in big houses to impress people that are criticizing you that you don't have a baby. You are throwing party for people that will come to your home and be saying, imagine they live in this big house. They drive this big car, but they don't have a baby. You're not impressing them, including your BBF. Best, how do you guys call it? BBF. Best friends forever. Nonsense. Stop pleasing them. Instead of using that money to go and buy a big house, which you will sleep on one corner of the bed, or to go and buy a big car to impress people, to have arrived. At the end of the day, whatever you do is in your pocket. The only thing that nobody can take away from you are your kids. You can have 100 million yesterday, today you're poor. Your father can give you billions and you squander the billion and you become poor for life. Or you can struggle and work out your salvation. But when you have your babies, nobody takes your babies away from you. You can use your car, you can use your house as collateral, but you cannot use your baby. Even if you borrowed money to have your babies, your debtors cannot come and take your babies away from you. Nobody. They have not given birth to that person. So the only thing that makes you to be wealthy, to be rich, are your kids. If your pastor is not preaching this to you, he's not a good pastor. Leave that church. Now, some of you might have a need to go and ask for help. Don't be too proud or too shy to ask for help. If you need help, you ask for help. At any point in time, we all needed help. We all asked for help. But if you're someone that is not good in helping people, how can people help you when you have a need? There are so many of you that don't help anybody in this group. You don't sponsor, you just show, oh, give me, answer me. Some of you will even be angry that I didn't answer you, but meanwhile, we don't sign contract. But you have never helped people. Now, when you need help, how can you get help when you've never helped people? But if you're a natural helper, like the Chiazokas, like the Jessicas, like the Margarets, come on now. No? You can never lack. So if you have been contributing money as tithe, as thanksgiving, as offering in your church, and they've been building those gigantic church projects, they've been trying to do this, do that. Your pastor is driving big car, living in big houses. Now you don't have a baby. And anytime you go to church, they will give you Bible verse and olive oil. Come on. Enough of that nonsense. If you go to church tomorrow, call a meeting. Tell them koro without pretending. Doc, I need a baby and I don't have this money. Can we arrange a special offering in this church? If your IVF is 1.5, let me tell you, there is no church in this world that can contribute money for you. Most of your pastors are billionaires. Some of them have private jets. Some of them have private schools. You can't even attend it. But still, you don't understand. You still cling to them, any little thing. Oh, touch not my anointing. My pastor is my this, my that. Meanwhile, they are using your little to contribute to big. And they can't give you the most important thing that will make you happy. You've been attending this church for 10 years. 10 good years. You have contributed to every single growth in that church. This is the time for them to help you. So don't be shy. Don't be shameful. Don't be too proud to ask for help. Ask your father, ask your mother, ask your uncle, your auntie, your friends. Some of you have some organization that can loan you money. I told you about a doctor that came to America. He won lottery visa. By the time they came in here, they discovered that time is not on their end. Before she was trying to write her professional exams, they needed to start their family. And they told them, hey, guys, you need to do something. She needs to borrow money. And they had triplets. What happened? The same people that gave them the money to go for the IVF forgave the money they gave them and became the godparents of the triplets. Come on, who wouldn't want to be a godparent to a child? Who is that person that will see a baby and won't like a baby? You know, one thing I owe you in my group is the truth. If you follow this truth, you're going to be a mother. If you can pray and play and practice, 2022 is going to be that your dancing year. Admin, capture this for me. If you can pray genuinely, some of us pray the wrong way. Only give me. I want you to pray like this. God, I thank you for waking me up this morning. God, I bless your holy name. God, even in this storm, I praise your name. God, I know I've come a long way. God, I know it's not because of my word or whatever, but God, if it's that will, let this cup pass. God, I commit all the doctors you're going to use. God, I commit all the helpers you're going to use to fulfill your word, because God, you promised me that I'm going to be the mother of all nations. God, this is the time. I'm not going to let you go until you bless me. This is how I want you to pray. And I'm challenging you to pray this way. Don't pray, gimme. Thank God for waking you up this morning. If God woke you up this morning, God has a plan for you. So many people have 12 babies, they've gone. So remember that you matter as an individual. Whatever it is, let it go. Take off that shackle and be in the now and give God the glory and say, God, I thank you that even the deaths that happened in 2020, you safeguarded me in 2021, and 2022 is going to be my dancing year. And wait and see if God will not, challenge you back. It's still the same God of yesterday. He hasn't changed. It's the same God that will lift you up and make you a mother, not just a mother of one. If you think, oh, just God give me one baby, you don't even know the kind of God you're worshiping, because it's a God that puts Jara. It's the God of Jara. The God of this group is the God of Jara. There are so many twins, triplets, quadruplets in this group. You can mark my words. I'm not your regular pastor, but I'm telling you today, if you can hearken to my voice and do the things you haven't done before and go the extra mile, because some of you are comfortable in your infertility. Comfort zone sucks. There is no progress in comfort zone. You have already given up hope. You are now looking at December to see other people that did something and had their baby or became pregnant, and you begin to say, oh, why me? Why not you? What have you done differently? If you need to be extraordinary, you need to do extraordinary things. So I'm challenging you today, because I want you to feel the joy of motherhood. It's an indescribable feeling. So wake up and do something today. God bless you for coming. Don't cry for anybody. Don't let anybody bully you. There is nothing wrong with you. You're the daughter of Most High God. Nobody can bully you. Nobody is your God. Nobody can mock your God. You are gonna dance like other women. There is absolutely nothing wrong with you, my sister. This is my truth. This is my confession, and I'm standing on it. Thank you for coming. Tomorrow is going to be our maternal and child health clinic. We're going to look for an opportunity. We're going to look for a good topic to talk about. But please, don't let my shouting be in vain. I can give you beautiful stories. I can give you beautiful testimonies. I can give you beautiful recommendations. I can give you best answers. If you don't show up and you make yourself available and you decide to pray and you decide to play and you decide to practice, you might end up not becoming a mother. That's a fact. I try as much as possible to keep my religiosity aside and separate it from reality. If you are not careful, if you do not change your ways, you might wake up, I can still be a Christian at 80, but you don't have a baby. But I challenge you to flip your odds today. God bless you for coming. I love you guys, and I'll see you guys tomorrow. Share this video with anybody you love. Share this video with anybody you genuinely want to help. We are in Facebook. We are in our group. We are in our page. If you're in my timeline, if you're my friend already, you're watching me free of charge. If you're in YouTube, we are there. If you're on Instagram, you're there. So there is absolutely no day you show up and you won't hear something from me or Dr. Ndiche. Okay? I'm going to go now. If your questions are not answered, show up tomorrow. We're going to answer them. But please, and please, do something different. Okay? Enjoy the rest of your weekend. God bless you, and bye-bye for now.